Most medical postgraduates believe thesis mistakes happen because of weak clinical knowledge. But here's a hard truth many don't like to hear. Most thesis rejections and corrections happen because of statistical errors, not clinical ones. You may have collected excellent data, followed ethical guidelines, and worked hard for months. Yet, a few basic statistical mistakes can quietly damage the credibility of your entire thesis. And the scary part, many students don't even realize they're making them. One of the most common mistakes is using the wrong statistical test. Choosing a test without understanding the type of data or study design is like prescribing medication without a diagnosis. For example, using a t-test when the data isn't normally distributed, or applying multiple t-tests instead of ANOVA when comparing more than two groups. Closely linked to this is another frequent oversight: not checking for normality at all. Many students assume their data is normal simply because the sample size feels big enough. But without actually testing normality using methods like Shapiro, Wilk, or visual plots, that assumption can be completely wrong. Another silent killer is ignoring multiple comparisons. When multiple tests are performed on the same dataset without adjustment, the chance of false positive results increases dramatically, leading to misleading conclusions that examiners catch very quickly. Moving ahead, another widespread error is using the mean for skewed data. In medical research, variables like hospital stay, cost, or biomarker levels are often skewed, yet students still report mean and standard deviation instead of median and interquartile range. This misrepresents the true nature of the data. Equally problematic is reporting only p-values without confidence intervals. A p-value alone does not tell you the magnitude or precision of an effect. Confidence intervals provide context. They show how reliable and clinically meaningful the result actually is. Without them, your findings feel incomplete and statistically weak. Perhaps the most misunderstood concept in medical theses is the p-value itself. A p-value less than 0.05 does not mean the result is important, true, or clinically significant. It only indicates statistical evidence against the null hypothesis. Many students overstate their conclusions, treating p-values as proof rather than probability. On the other hand, a non-significant p-value does not automatically mean there is no effect. It may simply reflect a small sample size or inadequate power. Misinterpreting p-values is one of the fastest ways to lose examiner confidence. So here's the key takeaway every medical researcher must remember. Statistics must match logic. Statistical analysis is not a formality added at the end of a thesis. It's a language that must align with your research question, study design, and data type. When statistics are chosen thoughtfully and interpreted honestly, they strengthen your work. When used blindly, they weaken even the best clinical research. Mastering these basics won't just help you pass your thesis,